Welcome to the Medicare Minute. Thanks for taking time to tune into the podcast. This is for agent use only. If you are not an agent, please do not proceed.
It's time for the Medicare Minute Podcast, where we talk about anything and everything Medicare related. If it's Medicare, we love it, and we want to help you learn to love it and become successful at selling it so you can help more people. Now, here's your host, Holden Hassel and Ron Reed.
Welcome back to the Medicare Minute with myself, Holden Hassel, and Mr. Ron Reed. Thank you so much for tuning in again. We can't tell you guys how grateful we are. We got some really fantastic feedback from our first podcast, and this is number 2. So coming at you live from here in Texas and Mr. Ron over there in Mississippi. So we have some stuff that we left off on last time, right? And we talked a bunch about what is Part A and what is Part B. And we wanted to keep it not too in-depth, but we want you guys to understand, right? This isn't stuff that you want to be explaining in-depth to your clients, specifically everything that we're teaching you, right? Because you're the agent. You need to know this stuff. So when you're explaining stuff to the clients, you want to make it easy to comprehend, because confused people don't do what? Confused people don't buy. So if there's anything that's difficult for your clients to understand, we want to make it simple. And we want to make sure that we're explaining everything compliantly. So what I'm going to do is I'm going to pass it to Ron, because we got a bunch of stuff that we told y'all we'd cover in this one without going too crazy. So, hey, Ron, could you just kind of give us the rundown on what is a MedSup and MAPD? What's kind of the difference? You know, what is a Part C? What does that stuff mean? So go ahead.
Absolutely. So, yeah, that's the thing that our members, I think when we left off last time, we're like, we want it all. We want Part A, we want Part B, C, D, and we want a sub. We want it all, right? So, and that's so we're going to pick up there, kind of where we left off. And can they get it all? Absolutely not, right? So you can't have them. You don't need a Medicare supplement if you have a Medicare Advantage plan. It will not coordinate. Okay, and let's talk about what the differences are. So on the Medicare supplement side, Holden. What a Medicare, so we talked about Medicare Part A and Part B and how that works, and how it has premiums and whatnot. So with Medicare, traditional Medicare, there are deductibles that have to be met on certain, for certain things. And once those deductibles are met, Medicare traditionally for most services pays 80%, okay? That leaves the member paying and owing 20%.
Wow.
On office visits, that's not such a big deal. The 20%'s not. But what if that member gets a $20,000 or $100,000 medical bill for stent placements, right? Yeah. And that's a fairly common thing, you know, that health conditions come up. So paying 20% of $100,000, that can really hurt some of our members. But so Medicare pays 80%, Medicare pays 80%, the members left paying the 20%, right? So what is a MedSup? A Medicare supplement supplements Medicare. It's the easiest way I know to say it, right? So it supplements Medicare. So that Medicare supplement, depending on which type, there's different types, and different types have different premium amounts, but the Cadillac is the Plan Gs and Plan Fs and Gs, right? And on those plans, that plan basically picks up the entire 20% that Medicare does not, right? So, and in order for the member to have that Medicare supplement, it's going to come with a premium. And some of the lowest premiums I've seen for the plan, the more expensive plans that cover pretty much everything. And if you're going to have a supplement, why not? You want it to cover everything, right? That's the purpose of a supplement. They're around $100 to $120 a month. Those are the average MedSup premiums, right? Of course, every individual is different, but so a Medicare supplement supplements Medicare. You have original Medicare that pays 80%. You have the Medicare supplement that pays the 20% that Medicare does not pay. And it comes with a very high premium. Usually, like I said, the lowest premiums are $100 to $120 monthly. Now, transitioning over into Medicare Advantage. But before I do, Holden, have I missed anything on the MedSups that you'd like to throw in there?
No, I think that's awesome. There is, like you said, there's some other plans as well that exist, but we're not going to go too complex. And there is going to be some deductibles associated with plans as well, but nothing nearly close to 20% of paying for $100,000 surgery or something crazy like that. Yeah, that's perfect.
Yeah.
Right in those MAPDs.
Right. So MAPD is an acronym in our insurance. The industry we're in is riddled with acronyms, right? So MAPD stands for Medicare Advantage Prescription Drug Plan, right? So, and you're going to see some variations of that. You're going to see people say, I wrote an MA. You're going to see people say that I enrolled someone into a Medicare Advantage MAPD. And the difference is the Medicare Advantage is just Medicare Advantage without prescription drug coverage. That's an MA, Medicare Advantage. MAPD is Medicare Advantage with prescription drug coverage included. We talked about Part A, Part B, Part C, Part D. Part A and B is Medicare. Part C is used to describe Medicare Advantage or MAPDs. And Part D is prescription drug coverage. And that's where the PD comes in, the prescription drug coverage. Okay. So MA is Medicare Advantage, Part C, and PD is prescription drug coverage, Part D. Okay. So that's a difference in an MA and an MAPD. Now, to tell you a little bit about how Medicare Advantage works without getting too in depth. So basically, Medicare, Social Security has looked at it and said, you know, it's almost cheaper for us to buy Medicare beneficiary insurance rather than paying the 80% of their healthcare cost. Well, insurance companies look at it and said, okay, well, we can get this money from the federal government and we can manage healthcare pretty good because that's the space that we're in. We can take that the money they were spending on the 80%, they can give that money to us. We can manage the healthcare more efficiently, and therefore the client can get coverage from the private insurance company, and their out-of-pocket cost is usually way less than that 20%, right? So Medicare Advantage, Medicare is buying the Medicare beneficiaries health insurance through a private insurance company, right? So every time someone enrolls into a Medicare Advantage plan, that's where the money's coming from. The federal government is paying that plan per member enrolled, right? So with that said, supplements don't work well and don't work with a Medicare Advantage because when someone enrolls in a Medicare Advantage into a Part C plan, Medicare is no longer paying the 80%. They're not paying the doctor. The insurance company is paying the doctors, and that's why it coordinates the care. So it covers, we talked about Part A, that's hospital. We talked about Part B, that's medical. And we talked about prescription drug coverage. And an MAPD takes Part A, Part B, and Part D, and it combines it all into one happy family, right? And so the Medicare Advantage plan, United Healthcare, Humana, the different insurance companies, right? They are paying the doctors, and those insurance companies are receiving funds from the federal government to do so. All right. So that's how these members can get plans at a zero premium, and it covers everything. Now, there are out-of-pocket costs. There are low co-payments associated. That's the difference in a MedSup and a Medicare Advantage plan. A Medicare supplement, Medicare pays 80%. The supplement covers the 20% the Medicare does not pay, right? And you're paying a hefty premium each month for that. No out-of-pocket cost. Medicare Advantage, you have co-payments, but a very low or no monthly premium to have the plan. That's the key. You're in charge. You're in the driver's seat. You pay the co-payments, right? Or the member is. We're putting them in control of their health care. So Medicare Advantage, it is not a supplement. That's why supplements don't work with it. It combines everything into one, and there are co-payments associated with it, but a very low monthly cost. Hold on, there's so much to talk about. I really I feel like I'm missing something, man.
I got you. Because that's awesome. So the next thing we're going to transition to is how to initiate the conversation. But I just want to pick up on what Ron was just talking about. So some very important things. $0 premium is a majority of the plans that we're going to be running into. Very important. When you have a MedSup, you need to have a Part D plan, otherwise you're penalized. Okay. And the penalty is important, but the Part Ds also have a premium. And Ron was talking about $100 to $120 for a MedSup. Are you going to run into someone that has a higher premium than that? Absolutely, where it may not even make financial sense. I've had people tell me all the time, paying $340 a month for a Medicare supplement plan, right? And they just can't afford it. So they need to drop it and get something else because our clients are on a fixed income. I mean, that's just the reality. Yeah. So we want to look at something that maybe can be an alternative, right? It's not as good. We all know Medicare supplements. That's the Cadillac, right? That's what we want. And that's what we could, if we can do that. But the reality is the clientele that a final expense agent is marketing to is more of a Medicare Advantage client than MedSup. But it's important to know that those are out there as well. So Medicare supplement premiums, they go up every year, and it's based on the pool of people. How large is the pool? How sick is the pool, right? So the insurance company may increase the premiums higher depending on how much money they're having to pay out of their pocket and how large the pool is. So you'll see bigger health insurance companies sometimes might have better premiums than other ones, but it's totally subjective, changes every year in terms of premium, and the cost goes up like their Part B premium. So sometimes you might walk into a home and they're paying $76 a month for their Part D prescription drug plan. And we might be able just to save them money on that. And that's great because we also get compensated as far as that goes just by providing them with the Part D. The other thing I want to hit on too real quick before we get into the next portion is clients always tell me, like, this sounds too good to be true. Is this free? And the answer is no. I mean, the reality is you're getting into Part A and Part B of Medicare because you paid taxes your whole life. Every single check that you ever had, Miss Mary, is you have federal government, state, if you got state income tax. You also have what? Social Security, Medicare coming out of those. So you have taxes that you're paying. You paid your whole life. Use the benefits that you are entitled to. Remember, you're entitled to Part A and you're enrolling in Part B to get these plans. You're entitled to it. You paid your whole life. So no, it's not free, right? It's a $0 premium. Okay. But like Ron was saying, you're still going to have out-of-pocket costs. With the Medicare Advantage prescription drug plan and also just a regular MA Medicare Advantage plan, you're also going to get the dental, vision, and the hearing that does not come with a Medicare supplement plan. So it's important to note that as well. MedSups, you got to buy additional stuff for other things as well. But with the Medicare Advantage plan, you can get this thing that we're going to go way more in depth about called the hospital indemnity plan that can make a Medicare Advantage plan like a MedSup light, right? Like a mini MedSup where you might get compensated going into the hospital and it's going to help pay for that stuff. You could get paid money if you get cancer, and this is going to offset those out-of-pocket expenses that you might have. So that's really cool. And hey, you know what? We're double dipping there. We're getting paid on the Advantage side. We're getting paid on the hospital indemnity side because we're able to provide these services to our clients. But I don't want to go too crazy, too in depth. So when we're looking at that stuff, it's important to add those notes in there as well. And Ron, before I go to how initiate the conversation, just all that I just said right there, is there more you want to add?
Yeah, I do. I want to touch on, I'm glad you mentioned the dental, the vision, the hearing. Yeah. So with supplements and traditional Medicare, there's a lot of benefits and coverage. So a lot of members want dental coverage. They want vision. They want those things. Medicare doesn't provide it. And so you can't get it. With Medicare doesn't pay, then the supplement doesn't either. So the supplement's not going to cover it either, right? So Medicare Advantage not only covers hospital, medical, and if it's an MAPD, including prescription drug coverage, all into one plan, but it also offers additional benefits. Most plans offer fairly rich dental, vision, hearing benefits. They even have meals on wheels. They have transportation benefits. They'll come pick the beneficiary up, take them to the doctor, and bring them back, right? So there's a lot of additional benefits, and they're still offered at no cost. These are no additional cost, and they're offered under Medicare Advantage. So make sure you're covering that and know that when you're sharing this information with a member. And one other thing I wanted to touch on, Holden, was in addition to those additional benefits, That is the maximum out of pocket. We talked about copayments. Yes, with Medicare Advantage, there are copayments, right? With a Medicare supplement and original Medicare, there are not. But some of the members will be concerned, or even agents may be concerned, should I put my client into this plan? Because those copayments can add up and be $10, $15, $20,000 if they have multiple serious health concerns or health issues in a calendar year. The answer to that is maximum out of pocket, MOOP, MOOP, right? So maximum out of pocket limits are set with almost all Medicare Advantage plans. They do vary from plan to plan, anywhere from $6,000 to $8,000 to $10,000 is the maximum out of pocket. But in a calendar year, if that member has $3 million in medical bills, the most they'll pay out of pocket is whatever that max out of pocket limit is set at. And now I think that's pretty much everything.
Yes. Last thing to note, I gotta say it, all MedSups are standardized by every single insurance company. And that's what we're talking about here. They are not any different by any health insurance company. They're standardized. A plan G with this company is going to pay the same benefits. Deductibles may vary or anything along those lines. But is that right, Ron? They're standardized by health insurance company. The only thing that may vary is premiums and what health conditions they take.
Absolutely, along with the Part D plans as well.
Okay, perfect. That's great to know. So let's go to the next segment right here. So that's a lot for y'all. So if you got a pen and paper, maybe writing some notes helps, or reaching out to Ron and I directly so we can help you kind of understand more of this stuff in depth is very important. So the next thing that we're looking at too is how do you even initiate the conversation? So one thing that is very important too is this little thing called a scope of appointment. When we're talking about Medicare Advantage prescription drug plans and getting into talking about Medicare, we want to have the scope of the appointment. We want to have that documented. What are we going to talk about? Well, we're going to talk about MedSups. We're going to talk about Med Advantage, Part D. We're going to talk about dental vision here, right? All the boxes you can check on a scope of appointment. We want to make sure that we're covering all the bases with the client and what the scope of the conversation is going to be. So you got to get that stuff, because compliance is the key, right? And I know a lot of people are like, the compliance is crazy. It's not that bad. Just make sure you follow these steps and you'll be just fine. I promise you, you'll be okay. It's not crazy or as crazy as you might think. So once we get that done and we maintain our compliance, we initiate the conversation. We're not doing both at the same time with final expense and Medicare, maybe, and the rules are always going to change, right? So when I say this, you could do same day scope, right? So stuff along those lines. But the rules are changing all the time. So I don't want to have one thing set in stone and then all of a sudden, 3 months later, it might change. So make sure you get the scope done. We're going to initiate the conversation by, you could just ask them, hey, who do you have for your health insurance? And they're going to tell you. They'll show you that red, white, and blue card, which is super important. That's really the starting point and everything along those lines. And sometimes they'll ask you, hey, I need help with my prescription drugs too. Or sometimes it's just easy. They're going to ask you. I mean, a lot of times, and Ron, you tell me if this is right too, clients just ask you all the time, hey, can you help me with my health insurance? Is that right?
Absolutely. And a great compliant way to start. A lot of the carriers offer pins that say, ask me about your Medicare options, right? Yeah. And it never fails. If you go into the home, they're gonna ask that question if you've got that pin on, right? Or if not, just grab your pin and hold it up, shake it, and say, hey, look at this.
No, you're right. Because you're so right. Because you can order stuff like that directly from the carriers. They want to help you.
Yeah. So, and one other thing that, I've had agents wear that pin to Walmart grocery shopping. Everywhere they go, they wear their pins because they want to have those conversations, and you don't know unless you ask. And one other thing that I wanted to throw in there is we're talking about compliant, how to initiate the conversations compliantly. Look, if you write someone final expense, they're your book of business. You can market, you can talk to, you can ask them. You don't have to wait on them to ask you. Yep. So if you've closed the final expense sale, now you can ask them, hey, who's your provider? What do you have that helps with your health care?
That's key. And it also, right on your scope appointment, right there, you're going to note this. who's this person? Existing client, right? That's so easy. Like you're saying, you can market to those people. So doing a presentation is actually really simple, right? You're kind of just going in. We have this tool, it's called Sunfire. Another tool that's provided, this is federal government, they set this up, Medicare.gov, and you can look at it because sometimes people will hand you 5 different health insurance company cards, right? Their plastic card they get from the health insurance company. And they're like, I don't know who I have. So going to Medicare.gov and their clients, they have those accounts, you can log in and it's going to tell them which plan that they have. You can go ahead and look on Sunfire, which there's a tutorial for that we have. And that's going to be a plan compare, which is awesome. So we can show them the differences and all what they currently have, the maximum out of pocket expenses. This one's $3,400, this one's $6,700. So we're looking at all that stuff. This one's an HMO, this one's a PPO, this one's got $3,000 in dental, this one's only got $1,000 in dental. So they're doing all this stuff right on Sunfire with these plan compares, and you can even download the summary of benefits. The best thing that I love, and Ron, you chime in on this too. The best thing that I love is these, your reps in your area, your local reps. In Dallas, I have 5 different reps, and they're broken up into segments. And then Fort Worth, we have another 5 reps that are broken up into segments just for United Health, just for one company, which is amazing. And these people, they get compensated, right? They're going to get bonus. They're on salary for helping drive up distribution. So any way that they can do it to help you guys provide these services to your client, they want to do it. They're responsive. They're answering their phone, text messages, and emails. So get in touch with who it is. Call your producer help desk with that health insurance company, that private health insurance provider that you're working with, right, that you're contracted with, and say, hey, who's my person over here? Who's my rep that I can talk to get in front of them? And I can't tell you, right? You can go pick up enrollment guides. You can pick up tools. Ask me about Medicare buttons, the pins that we're talking about, anything, marketing supplies. And how much does this stuff cost? It doesn't cost you anything, right? So it's great. And you have this stuff and you can provide it with the leave behinds for the clients, everything that they want to give you, they're going to do and put in front of you, which is way different than final expense, right, Ron? Like they want to provide so much stuff to you.
Oh, absolutely. So when you order, if you want final expense supplies from the carriers, it's like pulling teeth at times, right? But with Medicare, it's very different. They want to provide you the marketing supplies because, and all marketing supplies have to be approved by CMS. That's why Holden mentioned earlier, like we're offering this content to agents only. This is not marketing material, right? Because it's not approved. But all of these marketing materials, the pins, everything has to be approved by CMS. The carriers go to the trouble of getting that approved. They want to put it in your hands. They want to keep you compliant because they want to keep you selling. Yes. And look, in Dallas, you may have 5. Look, we're in rural Mississippi, right? But we do still have, and every market has a point of contact. A market manager is what most of the carriers call them. And you need to be in contact with that individual. They are there to support their agent force, their field force, whether it's captive, whether it's independent. They are there to support them and make sure that you have all the tools you need to be successful, whether it's the scope of appointments and how to help complete them, whether it's marketing materials or whether it's the presentations, right? Enrollment guides, summary of benefits. And if you call, you can go pick them up at their local office if you have one, or they will ship them to you at no cost. They want to get these materials in your hand.
Yes, absolutely. Which is awesome. So then we know that these people are getting taken care of and they want to take care of us. They're going to explain different plans to you in your specific area because plans vary, right? Some states, believe it or not, don't even have DSNPs, which is a dual plan for people that are on Medicare and Medicaid, but they might have a chronic special needs plan. So getting with those reps is going to be awesome. They're really going to provide in-depth information about your specific area because that's what they know. And then when we're looking at the next thing that now that we talked about, well, what is a MedSup? What is a Medicare Advantage prescription drug plan? We can add in a hospital indemnity. We talked about dental, vision, and hearing. We talked about how to initiate the conversation, right? How you can order and ask me about Medicare PIN or all those different tools, completing a scope of appointment and compliance, doing a presentation, how to go ahead and add that in to your presentation and market to your existing clients. So the last thing that I really want to talk about is, commission is super important, right? That's why you're here. Let's get down to the brass tacks of it. We want to get paid. We want to get compensated. We're not doing this for charity. We're in business. We're business owners. Cash flow is king. We love the renewal-based income because you've probably heard of someone that says, hey, I sold my business. I sold my book of business, right? Or a PNC guy, I sold my business. I used to work for XYZ insurance company. I sold it. Well, how do you get to something that's worth value, that provides a nice check to you if you want to sell it down the line? Renewal-based income is incredibly attractive to not only us as agents, but it's also incredibly attractive to maybe someone buying your book in 10, 15 years down the line, because it's guaranteed money. As long as that client stays on the books, you're getting paid, right? Let me say that again. As long as a client stays on the books, you're getting paid. You could have a client stay on the books with that health insurance company for 10, 15, 20 years, and you are getting paid. And then you can market to those clients again when the plans change every year and we get updates for 2022, 2023, 2024 plans. We're able to then continue to market to these people and say, hey, sometimes in areas they're completely getting rid of a plan, you got to go back to those clients. Sometimes they're rolling out a new plan with more rich benefits, and your market rep is going to tell you, hey, this is what we're looking at this year that might be in a better interest of your client. This is why this PPO is now better than this HMO, etc. Right? And what is a PPO and HMO? Why do we love acronyms? I don't know. It's just the way the industry is, but we'll get into all that stuff more in depth. But, simple thing,
right.
How commission works, it's pretty easy, right? So throughout the year, right now, we're going to go, let's just talk about 2022 plans. You're getting paid a check for an effective date of January 1 of $287. Now, here's the thing that people don't like. Well, what about February? The commissions are going to go down by $287 divided by 12. So let's just call that $24, okay? So $24 is what it's going to decrease monthly based on when the plan starts, also known as effective date. So when it starts in February, it's 287 minus 24. If it starts in March, 287 minus 48, etc. So it's decreasing throughout the year. So when do you really want to get started? You want to get started now, obviously, whenever you're watching this podcast. That's super important because you want to write people during the year. Well, can you sell all year round? That's something we're going to talk about on the next one. So, and we'll wrap up in just a second, but you're going to get paid for the life of the policy. You're going to continue to help market to your clients and see if there's something that you can provide to them every year that might be better than what they currently have. And your local rep is going to tell you that, which is super important. And that's when you're going to build up those renewals. When the plan renews the next year, they have the same plan, they keep it, and it renews the next year. And that's going to build up your book. During AEP, the annual enrollment period, if you write 100 clients and it's an effective date of January 1 and the commission is $28,700, well, or $287, you're going to get that check in January, one fat deposit of $28,700 of bonus check, and you're still going to be able to provide that final expense service to your client, the hospital indemnity service to your client, the annuity services to your client, and doing it all compliantly. So that's kind of how commissions work in a nutshell, and making sure that we maintain our book of business. And remember, this is going to keep your persistency higher with your existing client. The more products that you provide in one home, the higher your persistency. And with that said, I'm going to pass that back to Ron because I know he's got some stuff to add to that, exactly what I just said, higher persistency, how commissions get paid when plans renew. Very important stuff to understand. And then we're going to segue into what are we going to talk about on the next podcast. That way you guys can come back and see what we're going to do next week. So Ron, tell us kind of what you're talking about here and what you're thinking about with all that said.
So perfect. Persistency is, man, that's huge because that's what determines our income. Like the upfront commission's great, but if they don't keep the policy, you got to pay that commissions back, right? In some situations, if it's advanced. But at the end of the day, persistency, we want to make sure that that they're staying on the books with us, right? So on the life insurance side of things, there's ways to increase your persistency. That is thank you cards. That is birthday cards. That is, making sure you're available, answering the phone when your clients call. On the Medicare side of things, same ways to increase your persistency, but it's an annual review. Like you talked about, new plans come available. You want to make sure that you're following up with your members and putting them in the best plans that you can find available in their market, and annually review to make sure that that business is persistent. Make sure they stay on the books. If you're calling your clients, then everybody else that's out there calling your clients is not going to have any success with them, right? But if you're not talking to them, somebody else will, right? Now, with that said, industry-wide, it's a proven fact that the more policies you have in one home, the more persistent those policies will be. So, like Holden mentioned, if you're offering Medicare, if you're offering final expense and talking about Medicare along with annuities, that's 3 different products that you're offering in that one home. You're their one-stop shop. And that's what these people are looking for. They don't want to have to deal with multiple insurance companies, multiple agents, multiple products. They want one person to handle it for them all because it's confusing and it all runs together.
Exactly. And then let's talk about, so that's pretty much it for this podcast. And we're going to drop our contact info again. So if you guys need anything, reach on out to us. But what are we going to talk about in the next one? So we're going to talk about, yes, it's better to get started today before AEP, because carriers do have blackouts where they do not allow you to get contracted or get a release or something like that. So it's important to get started now before the annual enrollment period. Let's talk about in the next podcast, can we sell all year round? Do I want to focus on people that are just turning 65? What is an SEP? What's a special election period? Let's give you all some examples of that. How do I get started selling? Stuff along those lines is super important. So once again, my name's Holden Hassel. My contact information, my cell phone is 704-724-3648. And my email address, if you need anything, is holden@finalexpensemastery.com, HOLDEN@finalexpensemastery.com. And Ron, give us some parting words and drop your contact information.
Yeah, so I'm excited to share the next episode. We're going to talk about, like you said, barrier to entry is the thing I'm probably most excited about, because that's probably the most overwhelming to a new agent. They're like, this is a test. I only got 3 chances to pass it, right? So I'm excited about going over the barrier to entry, breaking that down so people can see that it's actually not as intimidating as it seems. This is something that we can all do, right? If you can pass your state licensing exam, you can pass AHIP, right? It's really not. So I look forward to breaking that down. And you guys can contact me anytime. Ron Reed, my cell number, you can reach me direct, 601-490-0520. And feel free to shoot me an email at rreid, that's rreid2179@gmail.com.
Perfect. And thanks for tuning in to the Medicare Minute. We love your feedback. If you have anything that you want us to cover, just shoot us an email, drop it in the group chats. Let us know what you think would be important for you to understand. Contact us personally. We want to help as best as we can, because this is such an important industry where there's 44 million existing beneficiaries. And then there's going to be, in the next 8 years, 79, almost 80 million beneficiaries of Medicare. So we want to get out there and help your clients today, and they'll love you for it. So thanks for tuning into the Medicare Minute.